Have you ever thought about what is it like to be in midlife?
Is it just about settling down, having your own house, paying bills, steady careers, or launching children to have their own lives?
Well, midlife is more than that. Middle age is being viewed as a time when adults achieve new heights in cognitive development, reevaluate their personal goals, change their behavior, develop great relationship with children, and ease into grandparenthood. This is the time in our lives where responsibilities would ultimately be served in our table. In this chapter, we will be discussing the following topics involving middle adulthood: physical changes and health, cognitive development, personality, family dynamics, and middle age. Physical changes. As individuals enter the phase of midlife, there are physiological changes that accompany them, and these are somewhat inevitable. And as we face ourselves in front of the mirror on that fateful day, the hard, inevitable truth would stare back at us. Some of these physiological changes includes changes in appearance, where wrinkles begin to show up. Wrinkles are caused by changes in the structure of the skin and its connective and supporting tissues, as well as by the cumulative effects of damage from exposure to sunlight and cigarette smoke. Gray hairs, which is perfectly normal and caused by a normal cessation of pigment production in hair follicles. There is also male pattern baldness, a genetic trait in which hair is lost progressively beginning at the top of the head, often begins to appear in middle age. And another change in appearance is weight gain. This is the so-called middle age bulge that occurs at early 30s and mid-50s as metabolism slows down as we age.
Moving on to another apparent physiological change in midlife are changes in bones and joints. Skeletal maturity. Bone mass in women stays the same until they reach menopause, and on the other hand, for men, it is until they reach late life where severe loss of bone mass can potentially be serious, for it could result to
osteoporosis, a disease in which bones become porous and extremely easy to break. It can occur in people in their 50s, and the possible cause for osteoporosis are deficiencies in calcium, vitamin D, estrogen depletion, and lack of weight-bearing exercises that builds up bone mass. And other risk factors are smoking, high-protein diets, and excessive intake of alcohol, caffeine, and sodium. According to National Osteoporosis Foundation, they recommend getting enough vitamin D and dietary calcium as ways to prevent osteoporosis, and it is also good to consume food such as sardines, milk, collard greens, broccoli, or kale. To increase awareness of the condition of our bones, a test called dual energy X-ray absorptiometry could be taken. This test is used to identify our bone mineral density, and it is highly encouraged to be taken by women who are in their late middle age or over 65. To lower the risk of osteoporosis, the following should be considered. There should be effective involvements of dietary, medication, and activity approaches. Taking supplemental magnesium, zinc, vitamin K, and special forms of fluoride may also be effective. Apart from these, we also have estrogen replacement that is effective in preventing women's bone loss after menopause, but it is controversial because of potential side effects. Bisphosphonates that are most commonly used and are highly effective but can have serious side effects if used over a long period of time. And raloxifene, which is one of the relatively new group of drugs known as selective estrogen receptor modulators. Selective estrogen receptor modulators are not estrogens, but are compounds that have estrogen-like effects on some tissues and estrogen-blocking effects on other tissues. Rank ligand inhibitor. An example of this is denosumab, a fully human monoclonal antibody induced bone loss, metastasis to bone, and giant cell tumor of bone. Another problem faced in middle adulthood are complaints of aching joints, commonly known as arthritis. This occurs when the protective cartilage in joints shows signs of deterioration, such as thinning and becoming cracked and frayed. There are two types of arthritis: osteoarthritis and rheumatoid arthritis. Osteoarthritis is a disease marked by gradual onset and progression of pain and disability with minor signs of inflammation. Usually affects the hand, spine, hips, and knees, sparing the wrists, elbows, shoulders, and ankles. Rheumatoid arthritis. Compared to the first type introduced, rheumatoid arthritis is a more destructive disease of the joints that also develops slowly and typically affects different joints and causes other types of pain and more inflammation. You will notice a pattern of morning stiffness and aching developing in the fingers, wrists, and ankles on both sides of the body, and joints appear to be swollen. We have the typical low-level therapy, which consists of aspirin or other non-steroidal anti-inflammatory drugs, such as Advil or Aleve. Newer treatments include disease-modifying anti-rheumatic drugs, such as hydroxychloroquine and methotrexate, that limits the damage occurring in the joints. A more advanced treatments that could be an option if medications do not provide relief is surgical interventions. An example of this is arthroplasty, or the total replacement of joints damaged by arthritis. Improvements would be evident as new materials help artificial joints last longer. Another change encountered in midlife are reproductive changes. Undoubtedly, there are middle-aged and older couples who clearly have active sex lives. A major national survey found that middle-aged adults not only tend to continue to enjoy active sex lives, but also enjoy romantic weekends, and about 6 of every 10 middle-aged men and women report that a satisfying sex life is important for their quality of life. Reproductive changes in women. As women enter midlife, they experience a major biological process called the climacteric. This is the phase where women pass from their reproductive to non-reproductive years. Menopause. This is the point at which menstruation stops. At this stage, the views of women are somehow divided. Some women view it as the loss of the natural ability to bear children, but others view it as a liberating change because they no longer need to worry about getting pregnant.
Premenopause. Before the menopausal stage, there is a premenopausal stage, the time of transition from regular menstruation to menopause, and how long it lasts varies considerably. Gradual loss and eventual end of monthly period is accompanied by decreases in estrogen and progesterone levels, changes in reproductive organs, and sexual functioning.
According to Women's Health, physical and psychological symptoms accompanying premenopause and menopause are hot flashes, night sweats, headaches, sleep problems, mood changes, more urinary infections, pain during sex, difficulty concentrating, vaginal dryness, less interest in sex, and increase in body fat around the waist. Decline in estrogen levels is a very big deal because it is related to numerous health conditions. According to Research Institute, there is a risk of osteoporosis, cardiovascular diseases, stress urinary incontinence. This is the involuntary loss of urine during physical stress. We also have weight gain, memory loss, and in short, almost every major body system can be affected. Menopausal hormone therapy, where women take low doses of estrogen, which is often combined with progestin, an effective way of treating menopausal symptoms and preventing cancer in the uterus. Changes in genitalia. Progressive changes in women's genital organs after menopause includes the following: vaginal walls shrink and become thinner, size of vagina decreases, vaginal lubrication is reduced and delayed, external genitalia shrinks. These changes have important effects on sexual activity because it increases possibility of painful intercourse, and longer time and more stimulation is needed to reach orgasm. However, maintaining an active sex life during adulthood lowers the degree to which problems are encountered. But despite these, active sex life has a lot more to do with the availability of a suitable partner than a woman's desire for sexual relations. According to the Sexuality Study of AARP Modern Maturity, the primary reason for the decline in women's sexual activity with age is the lack of a willing or appropriate partner, not a lack of physical ability or desire. Reproductive changes in men. Unlike women, men do not have a physiological event to mark reproductive changes. Although there is a gradual decline in testosterone levels, it occurs to greater extent in men who are obese or have diabetes. Men do not experience a complete loss of the ability to father children. This varies widely from individual to individual, but they do experience a normative decline in the quantity of sperm. However, even a man at age 80, he is still half as fertile as he was at age 25 and is quite capable of fathering a child. With increasing age, the prostate gland enlarges, becomes stiffer, and may obstruct urinary tract. Prostate cancer. This becomes a real threat during middle age. Men's physiological changes as age increases. There is a less perceived demand to ejaculate, need for longer time and more stimulation to achieve erection and orgasm, and much longer resolution phase, during which erection is impossible. According to AARP, older men also report more frequent failures to achieve orgasm and loss of erection during intercourse. However, the advent of Viagra, Cialis, and other medications to treat erectile dysfunction has provided older men easy-to-use medical treatments. And lastly, the most important ingredient to sexual intimacy with men and women is a strong relationship. Stress and health. You know what it feels like to be stressed, right? Whether it is from an upcoming exams, deadlines, or demands from a workplace. Stress seems to be everywhere. According to Levy and Bavishi in Press, stress involves both physiological and psychological aspects.
And there are a lot of approaches to stress, and the most widely applied approaches to stress are focusing on the physiological response that the body makes through the nervous system and endocrine system, and the idea that stress is what people define as stressful.
Stress as a physiological response. Prolonged exposure to stress results in damaging influences from the sympathetic nervous system, which controls such things as heart rate, respiration, perspiration, blood flow, muscle strength, and mental activity, and there is a possibility of weakening of immune system. Stress at a cellular level. At a cellular level, stress may play a role in shortening telomeres. According to Liu, chronic stress and cortisol exposure decrease your supply of telomeres. When the telomere is too diminished, the cell often dies or becomes pro-inflammatory. Gender difference in physiological stress responses. There are some evidence that the hormone oxytocin plays a different role in women than in men.
Oxytocin. It is a hormone important in women's reproductive activities and for establishing strong bonds with one's children.
Apart from oxytocin, researchers speculate that when stressed, men opt for a flight or fight approach, whereas women opt for a tend and befriend approach. The stress and coping paradigm. This paradigm views stress not as an environmental stimulus or as a response, but it views stress as the interaction of a thinking person and an event. It is a particular relationship between the person and the environment that is appraised by the person as taxing or exceeding his or her resources and endangering his or her well-being. This definition states that stress is a transactional process between a person and the environment that takes into account personal resources, that the person's appraisal of the situation is the key, and that unless the situation is considered to be threatening, challenging, or harmful, stress does not result. There are 3 types of appraisals of stress: primary appraisal, secondary appraisal, and reappraisal. Primary appraisal. It is the process that categorizes events into 3 groups based on the significance they have for one's well-being. The first category is irrelevant. These are the things that does not affect us. The second category is benign or positive, things that are good or at least neutral. And lastly, the third category is stressful. So we literally decide which events are stressful and those that are not. When a person believes that an event is stressful, a second set of decisions called secondary appraisal is made. Secondary appraisal. It is the process that evaluates one's perceived ability to cope with harm, threat, or challenge. For example, if you believe there is something you can do in a situation that will make a difference, then your perceived stress might be reduced, and you may be able to deal with the event successfully. In contrast, if you believe there is little that you can do to address the situation successfully or reduce your feelings of stress, then you may feel powerless and ineffective even if others around you believe that there are steps you could take. Reappraisal. It involves making a new primary or secondary appraisal resulting from changes in the situation. For example, you may initially dismiss an accusation that your partner is cheating on you, making a primary appraisal that the event is irrelevant. But after being shown pictures of your partner in a romantic situation with another girl, you reappraise the event as stressful. Reappraisal can either increase your stress if your partner had initially denied the encounter, or lower stress if you discovered that the photographs were fake. Coping. These are the attempts to deal with stressful events. We should take note that coping is learned, not automatic. That is why we often do not cope very well with stressful situations we are facing for the first time. There are two important ways of coping. Problem-focused coping. It involves the attempt to tackle the problem head-on, as it entails doing something directly about the problem at hand. Emotional-focused coping. It involves dealing with one's feelings about the stressful event, allowing oneself to express anger or frustration over becoming ill or failing. Effects of stress on physical health. Chronic stress. This have a significant effect on health, including pervasive negative effects on the immune system that can cause increased susceptibility to viral infections, increased risk of atherosclerosis and hypertension, and impaired memory and cognition, as well as psychopathology. Effects of stress on psychological health. Experiencing stress can trigger psychological processes and reactions. Although stress does not directly cause psychopathology, but it does influence how people react and behave. Post-traumatic stress disorder, an anxiety disorder that can develop after exposure to a terrifying event or ordeal in which grave physical harm occurred or was threatened. The kind of events that may trigger PTSD are violent personal assaults, natural or human-caused disasters, accidents, and military combat. How can we deal with stress? One way of dealing with stress is through stress reduction technique. One popular approach is mindfulness-based stress reduction. It is being aware and non-judgmental of whatever is happening at that moment. Mindfulness techniques results in functional and structural changes in the brain, especially in areas related to control of stress and emotion, as well as attention, memory, and sensory processing. Common approach using mindfulness-based stress reduction are yoga and meditation. Moving on, let us keep in mind a statement from Volpi, use it or lose it. It is a good mantra for this stage of development. It is important for us to use our bodies wisely and effectively to decrease the risk of complications in the future. And one way to do so is through exercise. Since the ancient Greeks, physicians and researchers have known that exercise significantly slows the aging process. Indeed, a program of regular exercise in conjunction with a healthy lifestyle can slow the physiological aging process and improve the immune system. Sedentary lifestyle. Being sedentary is absolutely hazardous to your health. Adults benefit from aerobic exercise. Exercise that places moderate stress on the heart by maintaining a pulse rate between 60% and 90% of the person's maximum heart rate. This exercise improves cardiovascular functioning and maximum oxygen consumption, lowers blood pressure, and better strength, endurance, flexibility, and coordination. The hallmark of cognitive development in middle age involves developing higher levels of expertise. Practical intelligence, the broad range of skills related to how individuals shape, select, or adapt to their physical and social environment.
Mechanics and pragmatics of intelligence.
Mechanics of intelligence. This refers to those aspects of intelligence comprising fluid intelligence. It is an expression of the neurophysiological architecture of the mind, so it is more associated with the fundamental organization of the central nervous system. Thus, it is closely linked with a gradual loss of brain efficiency with age. Pragmatics of intelligence. This refers to those aspects of intelligence reflecting crystallized intelligence, which means intelligence grounded by experience. It is associated more with the bodies of knowledge that are available from and mediated through one's culture. Thus, pragmatics of intelligence is more closely associated with psychological and social-cultural forces. Becoming an expert. As we all have intelligence grounded with experience, this tends to improve throughout most of adulthood. In a real-world experiential perspective, each of us become an expert at something important to us, such as our work, interpersonal relationships, cooking, sports, or auto repair. In this sense, an expert is someone who is much better at a task than people who have not much effort into it. We tend to become selective experts in some areas, while remaining amateurs or novices at others. Experts versus novices. What makes experts better than novices? It is on how experts handle the problem. For novices, the goal for accomplishing the activity is to reach as rapidly as possible a satisfactory performance level that is stable and autonomous. In contrast, experts build up a wealth of knowledge about alternative ways of solving problems or making decisions. Well-developed knowledge. These well-developed knowledge structures are the major difference between experts and novices. Lifelong learning. Many people work in occupations where information and technology change rapidly. To keep up with these changes, many organizations and professions now emphasize the importance of learning how to learn, rather than learning specific content that may become outdated in a couple of years. Thus, lifelong learning is essential for us to cope up with the changes around us. Middle adulthood, personality. In the past few decades, one of the most important advances in research on adult development and aging has been the emergence of a personality theory aimed specifically at describing adults, and this is the 5-factor trait model. We are now able to describe adults' personality traits using 5 dimensions. Neuroticism. People who are high on the neuroticism dimension tend to be anxious, hostile, self-conscious, depressed, impulsive, and vulnerable. They may show violent or negative emotions that interfere with their ability to get along with others or to handle problems in everyday life. For people who are low on this dimension, they tend to be calm, self-content, comfortable, unemotional, and hardy. Extroversion. Individuals who are high on the extroversion dimension thrive on social interaction, like to talk, take charge easily, readily express their opinions and feelings. People who are low on this dimension tend to be reserved, quiet, passive, serious, and emotionally unreactive. Openness to experience. Being high on the openness to experience dimension tends to have a vivid imagination and dream life, an appreciation of art, and a strong desire to try anything once. People who are low on this dimension tend to be down to earth, uncreative, conventional, uncurious, and conservative. Agreeableness. Scoring high on the agreeableness dimension is associated with being accepting, willing to work with others, and caring. And people who score low on this dimension tend to be ruthless, suspicious, stingy, antagonistic, critical, and irritable. And lastly, conscientiousness. People who show high levels of conscientiousness tend to be hardworking, ambitious, energetic, scrupulous, and persevering. People at the opposite end of this scale tend to be negligent, lazy, disorganized, late, aimless, and non-persistent. So what happens to traits across adulthood? Individuals may experience personality adjustment. It is the developmental changes in terms of their adaptive value and functionality, such as whether one can function effectively within society and how personality contributes to everyday life running smoothly. Personality growth. This is the form of personality that refers to ideal end states, such as increased self-transcendence, wisdom, and integrity. Changing priorities in midlife. Despite the evidence that personality traits remain stable during adulthood, many middle-aged people report that their personal priorities change during middle age. In general, they report that they are increasingly concerned with helping younger people achieve rather than getting ahead themselves.
In Erikson's psychosocial theory, he argued that this shift in priorities reflects generativity, or by guiding the next generation. Some adults do not achieve generativity. Instead, they become bored, self-indulgent, and unable to contribute to the continuation of society. Erikson referred to this state as stagnation, in which people are unable to deal with the needs of their children or to provide mentoring to younger adults. Midlife crisis or midlife correction. Middle-aged adults show the most complex understanding of self, emotions, and motivations. Cognitive complexity also is shown to be the strongest predictor of higher levels of complexity in general. From this approach, a midlife crisis may be the result of the general gains in cognitive complexities from early to middle adulthood. Middle adulthood adjustments. Stewart suggests that rather than a midlife crisis, such adjustments or transitions in midlife may be appropriately considered a midlife correction. Midlife correction. It is re-evaluating one's roles and dreams and making necessary corrections. Perhaps, the best way to view midlife is as a time of both gains and losses. Family dynamics in middle age. Family ties across generations provide the context for socialization. At the center, age-wise, are members of the middle-aged generation, such as middle-aged mothers who tend to care on the role of kinkeeper. So what is kinkeeper? Kinkeeper is a person who gathers family members together for celebrations and keeps them together in touch. Sandwich generation. Middle-aged adults are sometimes referred to as a sandwich generation because they are caught between the competing demands of two generations, their parents and their children. At some point, parents need to go on separate ways with their children for their children to learn and gain independence. But, of course, at the right age. Why do children move back? A major impetus is the increased costs of living on their own when saddled with college debt, especially if the societal economic situation is bad and the jobs are not available. Caring for their parents. The filial obligation is a sense of responsibility of the children to care for their parents if necessary. Stresses and rewards of providing care. Adults may have trouble coping with declines in their parents' functioning, especially to those involving cognitive abilities and problematic behaviors, and with work overload and loss of previous relationships with parents. The situation is likely to be perceived negatively and may lead to family or job conflicts, economic problems, loss of self-identity, and decreased competence. Caring for aging parents can bring parents and their old children closer together, provide a way for adult children to feel that they are giving back to their parents. And lastly, cultural values enter into the care-providing relationship in an indirect way. Grandparenthood. Most people become grandparents in the age of their 40s and 50s, though some are older or perhaps younger as their late 20s or early 30s. Middle-aged adult becoming a parent is a peak of experience. Question: how do grandparents interact with their grandchildren? Being a grandparent is meaningful. Grandparents are valued as role models as well as their personalities, the activities they share, and the attention they show to their grandchildren. Grandchildren also highly value the relationship with grandparents, even when they are young adults. As we end our discussion and as we face our midlife experience in the future, we would like to leave you a quote from Maureen Gaffney. You might have changes in many aspects aspects of your life, or very few, what matters is whenever or not you have managed to imbue your life with a sense of inner excitement, a sense that you are taking a new step in psychological development, becoming more fully and uniquely yourself. That is what ultimately will determine the quality of your aging.
What expectations do you have in your midlife? Share your thoughts!